Hi guys. I don't know that anybody's here yet, but I am such a good, patient and social media maven for my clients that my client, Dr. Adam Scheiner, say hello.
Hey there.
Okay, so we were talking and he's like, hey, why don't we periscope your Botox today? Yes, I get Botox. Okay, I'm 38. Give me a break. I worked in television. They're not nice to you. Botox is our friend. And you know what I really noticed? See this? I do a lot of selfies. Guys, this is not awesome. Like, this has to stop. Like, yeah. Okay, so yes, please. All right, well, you got it. So that's what we're going to do today is on the fly, we are going to periscope my Botox. And if you have any questions as we go along, just ask. And if you're wondering, yes, I've had plenty of Botox before, not in quite some time. It's been well over a year, as you could tell. Fillers and stuff too. So, all right, here, let's turn this around. This is Dr. Adam Scheiner.
Hello there, crowd.
Hello. All right, so Dr. Scheiner, tell everybody what you're doing right now. Well, first, what are you doing to me today?
Well, you were beautiful to begin with.
Aw.
But you know what, I'm about is I'm about making people better, right?
Yes.
Because I want the world to be able to relate to you in a better way.
Right.
Okay. So anyway, I've now decided what I think would be helpful for you because you do have, we're going to call them crinkles. Is that okay?
That's fine. Crinkles is fine.
You don't want any crinkles.
Yes.
Right? Okay. So
crinkles are okay for fries.
Correct.
But not for your face.
Correct. So I am going to help those crinkles. And the cool thing about this, we're actually going to raise your brows.
Okay.
And do you have any headaches?
Sometimes.
Well, this is really cool because this treatment also will help both migraines and tension headaches.
Okay.
So it's,
awesome.
Yeah, it's good for the whole family, right?
Yeah,
okay,
absolutely.
Okay, so I'm just drawing up the amount that I'm using. We use a very concentrated amount of Botox. So the nice thing about it, because I teach this around town. Actually, I have a course coming up in Tampa on, what date is it? August. Hey, Sally? When am I teaching? Is that August 6th?
Yes.
At the Westin in
Yes.
Harbor Island?
Okay.
So actually, I teach Botox and fillers to other doctors. I want everyone to, even though they might be competition to me, I want everyone to do the best job because I think it helps the whole field. So I'm actually giving a course at the Westin where I'm going to be teaching other doctors how to do Botox and fillers in the correct way.
Okay, so I have a question as I'm sitting here with Dr. Scheiner. So what's the difference so tell me your background. You are a
oculoplastic surgeon.
Oculoplastic surgeon. So doing a lot of advanced surgeries and things like that. And
Correct.
He's got all these fancy eye equipment here. But what's the difference in having this done by someone who is an actual surgeon, advanced doctor versus going to a physician's assistant or someone who's at like a med spa?
So I think that if the practitioner has good knowledge about aesthetics, facial anatomy, I think you're going to get a better result that way.
Okay.
And so, yes, I don't mean to disparage anyone. There are good physician assistants, other people who do this too, but my preference is that you have someone who really knows about anatomy because that's how you're going to get the best results. I mean, I teach this to people because I want them to get better at doing it.
Yeah.
But I will say people who are just starting are not going to be good as people who've been doing it for 17 years, right?
So, because I'm very open about talking about, what I have done because whatever, it's fine. I mean, I get Botox, it's fine. But a lot of people, in fact, I was just having a conversation with somebody last night and they're like, oh, so you just don't want to have expression and all that. And I've never had that experience where you don't have expression because for so many years, guys, working in TV, how often do I usually get it done every 9 or 10 months. This has been about a year, but I worked in television. I feel like I had plenty of expression. Right. I don't feel like I couldn't smile or do whatever. So I think that is a misconception that a lot of people have about Botox and things like that.
Right. I want to give you a result that lasts the longest too. Is that I'm doing this. I want this to last a long time for you. I want it to be a very complete result. But I'm going to allow your forehead to move, so you're going to be able to raise up and down. But yes, it's going to be soft. When you smile, you're not going to crinkle as much there.
Yeah.
I'm sorry. When you're trying to frown, it's not going to crinkle as much. But I'm being aware of the muscles, the ones that are not. It's about facial balance for me.
Yeah.
So I know the muscles that are appropriate to make quiet and the ones that are not.
Yeah.
Okay.
Yes.
So I'm ready. We're going up.
All right.
Do you want to keep it rolling? I get my assistant to help out.
Yeah, that'd be awesome.
Okay. Hey, Sally. You ready?
All right, so how many other TV people will do this for you guys? Like, let's be honest. TV people get this ish done, okay? Like, we get Botox. Like, I would really love to do my eyes. See, I've got saggy baggy. Nothing wrong with enhancements. I agree. I mean, it's just whatever. It's prolonging your life. Okay. Well, not our life, but like our face.
Help your nonverbal communication, right?
Yes, my nonverbal communication.
We want the world to relate to in a better way.
Because I have bitchy resting face. That's what. Okay, so I'm going to hand the camera over to Sally. Hi, Sally.
Hi.
All right, I'm going to give that to you.
And you can film me and my beautiful patient.
Yes. All right.
Okay. So if you'll rest your head back here for a moment.
Okay.
I'm going to sit you back.
Ooh.
Pretty wild, huh?
You look pretty
Well, I
wild.
will tell you, so here's the other thing. If you read one of my blogs, which is 11 tips for patients considering fillers, I talk about these things, these glasses.
Okay.
They look strange, right? A little funny.
Yeah, a little
Well,
funny.
what this does, this actually gives me ability to see anatomy in great detail. So that actually makes me a better injector. I can, it is possible that you can hit a vessel and get a bruise, okay?
Yeah.
But I do everything to try and avoid that. And if you're looking for someone to do your Botox or fillers, if they have glasses like this,
Yeah.
very likely they're more precise. So it's one of my 11 tips. And
Okay.
if you
Yeah,
read my-
I've never. I've had some good people that have done this before, but I've never been to someone who's had the super bionic glasses.
Exactly.
So
Exactly.
I know. Okay, mental note. So I've pointed out to Dr. Scheiner that in his videos he should not have. He has these. I'm sorry, I just got to call you out, Dr. Scheiner.
Yes.
That looks like a big vagina.
Oh.
I feel like, yeah, no, and I'm like, you can't put those in videos because it's just.
I like these actually.
I know.
Well, we can just put it by its side here.
We're gonna work on that.
Okay.
Okay.
I'm not
I'll
curious.
stop. I should not disparage his sculptures while he's about to stick stuff in my
I
face.
see. We're getting very, Freudian here. Okay, so I'm sorry to take up all your.
It was your idea to Periscope, by
I
the
know,
way.
I know,
so
I
this
know,
is what you get.
I know. I can help the comments that come by.
Okay.
So anyway, I'm sorry. I'm taking off your makeup here.
That's all right.
Okay, let's start with our 46 first. Okay. Okay, so first things first here.
Okay.
Turn just a little bit this way. And the first one's going to go right here. You okay?
Yep.
I guess that's our first injection.
So I didn't feel anything, by the way, guys. There's a little bit of numbing cream, but
That's pretty cool, huh?
yeah.
Yeah,
But
'cause I try and do this in a way that distracts you, Bring your brows together again for me and relax. Good. And together again and relax. Good. And one more time and relax. So this is actually a spot that a lot of people want Botox
why is that?
because they're concerned about it going over the upper part of the bone here and affecting the lifting muscle. Because I know what I'm doing, I actually feel very comfortable doing this because it actually will give you a better result. And I want to get you the best result possible. If that's okay.
Mm-hmm.
And I'm going to be interested actually at the end with you because we can actually get mood elevation with this.
Really?
Well, it's funny, irrespective of the idea of depression, people actually get mood elevation after Botox. Not because they think they look better, but there's something that happens with the feedback of frowning. And when you don't frown, your brain says, wow, we're not frowning, we must be in a good mood. And
Yeah.
sometimes people have mood elevation with this.
I could save money on my therapist now. This is fantastic.
Come to the hair again. One more time, and relax, good. So like here, I can actually see a vessel right underneath the skin. So I leave that one alone and
Wish I
massage it
could
into
see
the place
that.
that I want to be. And that's great because we're not leaving tons of bruising here because that's what these great glasses are about.
Yes, no bruising.
If we can, not that we're never ever going to have a bruise,
Right.
but we try and do everything we can to try and minimize it. I'm sorry, I'm taking off all your makeup
That's
here.
all right.
I'm so sorry. We're cleaning the area. Okay. And this is really for our brow. Okay. And close your eyes tight for me. Kind of squeeze. And then relax. Good. So This is the important part of the muscle right here. That's one. So we're going to do a level 3 brow lift on you.
So what does that mean?
Well, that's the most brow lift I can get. I have a level 1, a level 2, and a level 3.
Okay.
Okay. Close again tight and relax. Good. You doing okay?
Yep.
Excellent. Vent. We get another one of these cleansing alcohol swabs.
So if anybody's asking questions, I apologize, but we have Sally here that's manning the camera, so I can't see your questions. But
They are asking, how many needles?
how many needles?
We have a total of
Oh, I'm seeing them. I
3
should be
needles,
reading
I
them
guess.
to you.
Well, how many sticks you mean? Is that what they're asking? How many sticks?
Yeah, well, how many needles? Probably how
Well,
many
the amount of
sticks.
we're doing is just the right amount. And no more. That is it. I mean it. And I want you one more than the right amount. Okay.
You had a couple come up. I'm sorry. I should be reading
No,
them
no,
to
that's
you.
okay. I just, if people are.
They are? How many sticks, they said.
Just the right amount.
Just the
Okay. They can count actually. Okay, smile for me. Big. That's the area you want to help out here. And relax. Good. So I kind of spread here because oh, and there are the vessels. There they are. I could be right between these.
Sounds like too many, LOL. Never too many.
And smile again. And relax. Good. It's kind of interesting because I don't really ever broadcast my treatments, you know?
They're secret? Top secret?
Well, I teach it. It's fine. Yeah, and for doctors out there who want to train on August 6th at the Westin Harbor Island, I'm teaching this.
How long does this last,
Smile.
this treatment last?
4 to 6 months. Smile again and relax. Okay, smile again, big, and relax. Good. And one more time, and relax. Good. Okay, you'd open your eyes for a moment, and then look up a little bit, and smile, big, and relax. So the thing is, we don't want you to relax now, but keep looking up though. We don't want little crinkles, you know, like the crinkles underneath the eyes specifically.
Mm-hmm.
So I will often do a little bit. And
Question about cost.
when people come in, we can give them an exact quote for what's required, but it ranges. You can have a short of like 200, 300, up to 1,000 or more, depending on how much we're doing. Smile again and relax. But the cool thing I like about this is that we give results that last a long time too. I know, it's like, what is it doing? But I have to say, it's kind of nice we don't have a lot of bruising and anything that we've done treated you with here. Good.
So keep in mind, because this is at level 3, I'm doing a lot more than I think, you know, like...
Other people might too, right?
Yeah. Like I said, it's been well over a year since I've done anything, so I'm kind of doing a little more than... Normally I would do a little here, a little there.
And that's the other thing too, is that we can do this in parts. I mean, I am giving you, this is probably some of the most I'll do on a patient.
Mm-hmm.
But I mean, I'm excited this will give you the best result too.
How old are you, Meredith?
I'm 38. I'm 38. So, but I've been getting Botox for probably 3 or 4 years.
And she's a very cute 38.
Oh, thank you.
You're welcome.
I mean, it's just, again, I mean, I worked in the television news business, and it's not forgiving a lot of times. So,
Okay, smile
High
again
def.
for me, big, and relax. Good. Yeah, we were talking about that, right? About the way the news business is.
mm-hmm.
That's going to get the first part of the brow left, and then we'll do a little more here.
Ow. Someone goes, ow.
And smile one more time, and relax. Good.
Honestly, like, it doesn't hurt, and the tapping thing that you're doing, I haven't had somebody do that before, but that seems like that makes a difference.
So it turns out, because I know about anatomy, right?
Mm-hmm.
So what happens we're going to educate the audience here.
Okay.
Along
Me too.
Along the spine, there are 2 pathways called the basal columns that travel up toward the brain. One carries temperature
Okay.
and temperature and pain. The other one is pressure and vibration. So you know when you stub your toe, you kind of rub your toe?
Mm-hmm.
Because you're trying to overwhelm the pain sensation with vibration. That's kind of the same thing I'm doing. I'm tricking your brain.
Okay.
Because I don't want you to feel pain if you don't have to feel pain.
Right. Yeah.
Yeah, that's what I'm about. Okay.
They
smile
say
at-
kudos for you for putting this out there.
Smile big. Real big. And then relax. Good.
Boy, that light's right in the way.
Is it? Okay.
So one of the things that Dr.
Smile
Scheiner
big.
does.
And relax. Good. Here, I'm starting to put the light on a little bit.
Okay.
Because what I'm trying to do is avoid every vessel I can. And look up again. And good. Okay, we are all done.
This is like the Real Housewives of Tampa.
Well, last thing I'd like to do is, okay, you guys talk for it, and I'm going to get the peroxide.
Okay.
We're going to clean her up.
So that took what, 10 minutes maybe?
10 minutes
It was
at
like
the
nothing,
most.
and honestly, it doesn't like this eye is tearing only because I was like looking up in that light, but it doesn't hurt. Dr. Scheiner says it's. I mean, usually I start to notice it within 3 or 4 days. You won't really get like a full.
For 10 days.
Yeah.
I would
Yeah.
say, like, yeah, you won't see it today. Tomorrow, by 3 to 5, I usually say like 5 to 7. Some people notice it sooner. I
Yeah.
will say there are people who notice it sooner.
Somebody just said, does my 50-year-old skin need a level 8?
That's funny. I only have level 3, so.
So level 3 will do.
Exactly.
But one of the things that Dr. Scheiner does, which is pretty amazing, is he has a procedure to fix those big blobs under our
Festoons,
eyes.
eye
They're
bags.
called festoons.
Yeah.
But and this is funny because working in this business, I've actually had image consultants tell me on numerous occasions that I should surgically remove these bags under my eyes, and I'm like, my dad gave me these bags. Like, it's just a
They're
sensulo
precious.
trait. But if I ever did want to do that, Dr. Scheiner can actually do it with a minimally.
Take your
invasive
glasses off, Dr.
way.
Scheiner.
We do it with laser too. which is
Yeah,
nice.
with the laser.
And
So
the laser's nice because the laser's a couple things. When we use laser for surgery, it actually seals blood vessels and nerves.
Mhm.
Less pain, less bruising that way.
yeah,
And then the other laser that I use, which is really nice, is I can flatten skin. I can get new skin to come up, which is
Yeah.
really cool. It has a little recovery steps with it, but we get amazing results that way.
yeah. But I've always said, especially now that I'm not like on TV every day, I could just go in and like let my face fall off and grow a new one. Because you have that like downtime,
Right.
you know. I would not be good in your office to be like, "Hey, come let your face fall off." You know, I
And then someone
You-
says,
diplomatic, but
you have somebody saying they need less bags too.
well, you
Call us.
come back to Dr. Scheiner because it's really cool what he can do because it's advanced. Because I had actually researched it. It was probably a decade ago when the first consultant was like, "Oh, you should have surgery to remove this," and I was like, I don't know that I want to have a big surgical procedure with somebody cutting on my face and all of that. And,
I want to try and get people back to their lives as soon as possible when I'm doing these things.
yeah, yeah.
Well, you did great. So, okay.
Thank you.
So, instructions that I'm going to give you, and
Okay.
I'll say for when we do
Dark
this-
circle under eyes is a big issue.
Right, and I help that all the time. If they want to look at my site, they can look at my appearance on Dr. Oz or the doctors or Howard Stern or one of those things, and they can learn about me.
Yeah, you talked to Dr. Stern about under eye bags.
Howard
didn't you?
Stern. Well, Howard, I talked about upper lids when I was on Howard Stern. Talking about upper lids, and I also talked about sculpture. Sculpture would be great for Howard.
Okay, that's kind of like a
for more
lifting.
body, the whole
Yeah.
face.
Okay.
But the nice thing, so two things. One, when you have Botox, I often say, I don't want you to exercise today.
Oh.
No, I can write that note.
Darn.
I can write that note. I will. I'll write your note here. I will write that trainer saying, I am so sorry, Meredith, is excused from exercise today. Tomorrow, you're on your own. Okay, but just today. And the reason is because I'm really precise where I put this. I don't want this to move anywhere except for where I placed it because that's going to give us the best results. The other thing is, it is now almost a little after 3.
Yeah.
Starting around 6 or 7 o'clock tonight, I want you to actually work the muscles. You're going to practice
Okay.
actually frowning and smile. I mean, don't frown when you're around people.
Okay.
But otherwise, fine.
She doesn't frown.
And what will happen is the Botox is around the nerve. It's not in the nerve yet. We want it to get in the nerve. Every time you work the nerve will take a little bit of what's around itself.
Huh.
So when enough of this nerve is firing, it'll pull in more of the Botox in, you'll start to see the result. You'll see the results sooner, and actually it'll make it lasting longer. So if you do it, you don't want to do it now, starting around maybe 6 or 7 o'clock tonight for this evening, the next day, and the next day, but you'll see the results sooner, and it'll actually make it last longer.
See, and that's interesting because nobody's ever said that to me. And in the past, I felt like I need to try to remain as neutral as possible because I don't want to screw it up.
Right, and I would say for a couple hours, I'm agreeing with what you're saying there, but after that, let's work these nerves so that we get the uptake sooner.
Okay.
You did great.
Cool.
Well, thank you to the Periscope Twitter world, and thank you for letting us broadcast.
You're welcome.
It's all about educating patients about all the options out there, and you did great.
Thanks. And in the next week or so, when all my selfies, hopefully this will be gone.
Oh my God. It's
all gone.
Honestly, it's going to be fantastic. You're going to love it.
Yay. Thank you, Sally. Everybody
You're
say
welcome.
thank you, Sally.
Someone else just
Thank
popped up.
you. Don't hang around funny I know, right?
What did you say?
She said, "Don't hang around funny people for a bit." So yeah. All right. Well, this is
No laughing aloud.
So this is it. So thank you guys for watching, and
great.
I'll keep you posted. All right. I gotta remember how to turn this off. Ooh.
That was great.